Whoa. Before you go, there's 5 tips that I want to share with you on how to get a level 3 on your ATI, Fundamentals Comprehensive Exam. Now, if you're someone like me, maybe you had fundamentals towards the beginning of your nursing school journey, and you probably didn't take it that seriously. However, if you follow each of these 5 tips that I have to give you, you will indeed, with proof, get a level 3 on your ATI, Fundamentals Comprehensive Exam. And in fact, I may have a secret recipe that you can utilize to help you towards your ATI studying process. Whew. All right. I did my part now, Jamal. You can start the video now.
You're welcome, you're welcome. Here's another glimpse in the life of Mr. Seldom. On a mission to heaven so he can tell me well done. He got all my secrets, he promised he never tell none. You're welcome, there's no other feeling like it.
What's good, everybody? It's Jamal Hockey, channel dedicated to helping individuals unlock the will to conquer imagination. And if you truly believe in self, as well as the content being posted here on this channel, then we can indeed help turn the you that's you into something that's more valuable. Now, today, we got a good one for you. This is the ultimate study guide. I want you to really lock into every single thing that I have to share with you on this video, because if you truly watch this video from beginning to end and utilize some of the things that I will be offering to you, you will indeed get the level 3 that you're trying to achieve.
You think I'm playing?
Now, first things first, I have 5 tips that I'm going to share with you on how to get this level 3 in ATI fundamentals. The most of my time is going to be spent on tip number 1, and as well as sharing with you about the other remaining tips. But for starters, everything that I will be going over, you will be able to incorporate within your life. It doesn't matter whether you are a single father, single mother, you have a job or two, you work in hella hours, maybe the school that you go to is giving you a lot of work. Regardless of whatever the situation that you may be in, okay? All right? It's going to be good. It's going to be perfect. These notes is tailor-made for you to utilize to help you towards your studying process. So, with that in mind, tip number 1. I want y'all to really lean in on this one. Tip number 1, okay? One of the things that I learned, and this is going to be very different than any of my other ATI proctored exam or comprehensive exam videos, is that there's a difference between the nursing student sharing with you about how they got a level 3 or how to get a level 3 versus the actual nurse. I'm going to repeat that one more time. There's a difference between the nursing student versus the actual nurse, right? So that means I now work in the field where I am walking the walk. I am talking the talk. About these things that people are learning in school. So I have a different perspective on all the information that I get to go back and relearn, or the information that I get to go back and re-answer, because my approach is different. So again, tip number 1 is, first things first, you need to learn/master how to approach the actual subject of fundamentals. You need to learn and master how to approach the subject of fundamentals. Why is that important? Okay, first things first, what is fundamentals? Fundamentals is essentially the basic principles, right? The basic principles and procedures of nursing. Let's repeat that one more time. Fundamentals is the basic principles and procedures of nursing. Why is that important, right? Because if you don't conquer or get past fundamentals, which is typically towards the beginning of your nursing school journey, it's going to be very hard for you to get past these other subjects. If you don't have a solid understanding of fundamentals, it's going to be harder for you to have a solid understanding of adult med surg, or a solid understanding on how to be a well-rounded nurse. You get my drift here? So what exactly does it entail? What goes under the art or the subject of fundamentals, okay? So with fundamentals, I want you to think about these things right here. Critical thinking, Okay, evidence-based practice. There is something that has been done throughout the years that it proves that what is being done within the hospital can be justified based off of evidence-based practice. Okay, patient-centered care. Who are we there for? Yeah, granted, there's some nurses out there that may be working for a check, but ultimately, when we clock in, we're working on the behalf of the patient. We're trying to advocate for the patient. Okay, you see where we're going with this? Okay, so again, that's 3 things so far: critical thinking, evidence-based practice, patient-centered care. Okay, number 4, clinical application. You are now in the stage in your nursing school process that when fundamentals gets thrown at you, you're probably already doing clinical rotations to some degree. Okay, it's super important for you to pay attention to what is happening in your clinical rotations that you're doing. It doesn't matter if your clinical instructor is bad, piss poor, or doesn't really give proper instructions. It doesn't matter if the facility that you're in may not be that great. You got to make the most out of your experience because it's your license that you're trying to achieve.
Perfect.
The people that you're there working, the instructor that's there, they already got their license. When you show up to the hospital, those people that work at the hospital already got their license. They already passed nursing school. Now it's on you, okay? So that's number 4, right? Number 5, again, these are not tips, but these are things that go under the basic principles and procedures of nursing, okay? Number 5, the nursing process, right? You got to understand that assessment, diagnosis, planning, implementing, and evaluation, right? Understand the 5 things that constitutes the nursing process. And then number 6, right? Number 6 is therapeutic communication. Now look at me when I say this. So help me God. You better not miss any therapeutic communication questions on this exam.
Not on my watch.
Right, therapeutic communications, you do not miss those. I repeat, you do not miss those. Right, tell me more, right? Get that stuck in your head. Because we want to invite the dialogue. We want to invite discussion because that's how we get more information from the patient. Make that rhyme, right? That's how we get more information from the patient, okay? So, the next thing, again, this is still step number 1. Tip number 1, okay? Think like a nurse. Whoa. Think like a nurse. I want you to envision yourself as a nurse. I want you to become the nurse. Imagine yourself as the nurse. Reason why this is super important because you may not really get a firm grasp of this. Sometimes people, when they look at a race, this is a marathon, it's a journey. Fundamentals typically happens towards the beginning of your race, so it seems pretty far out. I'm here to tell you that it's not far out, right? You graduating is around the corner. You graduating is literally around the corner, right? So it's super important for you to already put yourself in the position of being a nurse. The reason why? Because when you're answering the questions, when you put yourself in the position of being a nurse, that means you're putting your license on the line, right? That means you're putting your job on the line. So when you make the incorrect answer, that's you not properly prioritizing a certain patient that you should be seeing. That's you not properly prioritizing the actual step that you should be implementing or a certain therapeutic communication tactic that you should be implementing because you're answering incorrectly. You have to look at it as if you are a nurse when you're answering these questions. And this is a nurse right now telling you this information, okay? So that is what's something that changed my mind when it came to answering these questions, because the moment I started thinking like a nurse and became the nurse, and I'm literally am currently a nurse, it was really hard for me to miss questions. I started getting them correct left and right. Oh! And I'm imploring that same mindset and that same sentiment onto you. You can do the same thing. So that's why this tip number 1 is super duper important, people. Tip number 2, okay? This tip number 2 is going to be nothing different than what you heard me say this tip number 2.
Of course.
You have to do hella practice questions, okay? Hella practice questions. Now, for people who are new to the channel, who never seen your boy before, What does it mean to do hella practice questions? Okay, you need to do, and it's not gonna really sound like a lot, but let me break it down. You're gonna need to do 50 to 75 questions per day, right? Per day, right? Why is that important? Right? You have to practice as if you're actually in the game. For anybody who's ever played the sport, you have to practice sometimes in game speed so that when you actually are in the game, you kind of know what to do because that's the way that you've been practicing. So what does game speed look like? We know that when we take these ATI proctored exams, these comprehensive exams, they're going to be about 70 questions. So I'm saying 50 to 75 because you get a little bit of under and you get a little bit over, okay? This is not to overload yourself with questions. It's only 403 questions in dynamic quiz for these particular fundamentals questions, okay? So where exactly are these questions coming from, right? Dynamic quiz, right? Standard quizzes and practice assessments A and B, right? That right there, you have a lot of questions to answer. So you got plenty of practice to get up. You got plenty of reps to get up. You got plenty of jump shots for you to shoot in order for you to get that jump shot looking right, in order for you to get that form looking right, okay? So what's the main purpose of doing this though? Why 50 to 75? It's to expose you to as much information as possible, because by doing this, you will right? When you expose yourself to as much information as possible, you start picking up on certain patterns, okay? You start picking up on certain patterns for what they're actually looking for. ATI is not stupid.
Nope.
It knows what to actually ask you. It's trying to gauge your level of understanding for the particular subject. So it's not going to be asking you just willy-nilly questions out the blue. It's going to ask you the bare bones foundation of fundamentals, because fundamentals is the foundation of nursing, right? It's the blueprint of nursing. So it's going to ask you questions that's going to consist of having a basic understanding of what the fundamentals is of nursing, okay? And so B, the other thing is, when you're doing these questions, please, for the life of me, flag the questions. Do this on study mode in dynamic quiz, right? Go to study mode, not time, but study mode. And I want you to actually flag these questions. I want you to flag the questions that you get incorrect. I want you to flag the questions that you guessed on. And I want you to flag the questions that you may want to spin the block on to see again. Okay? There's nothing wrong with exposing yourself to as much information as possible, because it's only going to guarantee that you get that level 3. So tip number 3, you have to read the rationale of every single question. It doesn't matter whether the question was easy, moderate, or hard. I'm gonna repeat that one more time. It doesn't matter whether the question was easy, moderate, or hard, right? You need to read the rationale of every single question. Matter of fact, you need to read the rationale of every single answer choice. This is the tip that's going to make or break, that's going to decide whether you get a level 3. I'm gonna repeat that one more time, okay? This tip right here is going to be the deciding factor whether you get a level 3 or not. This is what is going to separate the people from the haves and the haves not. One of the things that I noticed from people that get the level 3s is that they read the rationale. Why? Because they got an actual understanding for the question, right? And the reason why it's important to read the rationale, even the incorrect answer choice, is because the incorrect answer choice could have been correct only if it was tweaked a little bit. For example, let's say, for instance, we're dealing with tracheostomies and clearing of the airway, right? And it was telling you to pull back on the suction catheter, right? And the answer choice said to pull back, I don't know, let's say 1 inch. That would be incorrect. But however, the correct answer is 0.5 inches that you will pull back on that suction catheter, right? You see the difference? That if you start to read the rationale, it will tell you how the answer choice could have been correct. And it's super important for you to lock in on like really simple things like that, because it's going to help consolidate on your studying process to allow for you to answer the question correctly the next time you see something similar to that. ATI will ask you similar questions to things that you're already seeing, because it wants to gauge your basic level of understanding of the subject, right? Nice and simple.
Oh, is that so?
And tip number 4. Hold on. Let's move over to the next screen to talk about tip number 4 really quickly. And tip number 4, you have to utilize my study guide in conjunction with utilizing any other resources at your disposal. Okay, what exactly does that look like? For starters, let's say, for instance, you're someone that does like to read books. Okay, well, you have this lovely, thick-ass ATI Fundamentals Comprehensive book, right, to use. Now, if you want me to be honest with you, don't waste your time on reading every single page of that. Unless you're just a really quick reader, do not waste your time on reading every single page of that, okay? I am here to help you consolidate on your study to ensure that you maximize on your time to get the level 3 that you want to achieve. Perfect. So, what you need to do is, if you do plan on utilizing this book, right? Utilizing the book, because that's where the information comes from, you need to be looking at subject matters that you feel like you're going to struggle on, or you feel like you're having a hard time really understanding, right? Because the book is going to help you get a better gauge of the particular material. However, I done a service for y'all, right? I made an ultimate 41-page study guide, the ultimate guide, okay? Within this study guide, I'm going to tell you right now, it includes tips, images, charts, tables, and 15 unique 15 unique questions for your disposal for you to be able to answer. There's 15 multiple choice answers for you to be able to answer at the end of the study guide, okay? Right? Who else is doing something like that? I don't know anybody else is doing anything like that, okay?
Nope.
So, just to share with you, that's all tip number 4, by the way. This is all tip number 4. Utilizing my study guide in conjunction with the practice questions and any other resources that you can at your disposal. So tip number 4 is that. So what exactly is tip number 5, Jamal? Okay. So tip number 5 is pretty interesting. So tip number 5 is topics that's likely to be on the comprehensive exam, okay? So I hand selected some topics that I frequently came across during my fundamental studying process, okay? So let's go ahead and discuss this really quickly. So first things first, right? Nursing process type questions, right? You need to be able to get these correct, right? Like I've already discussed within this video: assessment, diagnosis, planning, implementing, and evaluation, right? The question may ask you something along the lines of them talking about something, and it's going to say, what part of the nursing process is this nurse utilizing? And you have to be able to answer it based off the provided information. Let's move on to the next topic really quickly. Knowing types of transmission precautions to implement based off of the provided information. Why exactly is that important? Okay, you're going to come across a patient that may have tuberculosis, or some other form of an airborne disease that could be transmitted via airborne, right? So you have to know what to incorporate in this particular situation. For example, airborne precautions, you'll have the person in a private room with negative pressure airflow room, okay? N95 mask for the healthcare worker, but a normal surgical mask for the actual patient, okay? When they are outside of the room or when they are at home. Not an N95 for the patient, but a regular surgical mask. Why is that important? Because if you think about for an immunocompromised patient, so that's a patient that's a cancer patient, chemotherapy patient, a patient that's trying to get a stem cell transplant, right? Immunocompromised. There's a little bit of similarities between the two. For example, the immunocompromised person is going to be in a private room as well. And also the immunocompromised person is going to need to wear a regular surgical mask when outside the room to prevent from getting affected, because their immune system they're more susceptible to getting sick. However, The difference between airborne and immunocompromised, airborne is negative airflow pressure, right? While immunocompromised is positive airflow pressure. Super important for you to understand these things. So you're going to get these types of questions on the exam. What's the next thing? Ergonomic principles. Ergonomic principles, okay? You need to know how to lift, how to move, how to push, how to pull. Things of that nature, right? Even whether you're moving, lifting, pushing, pulling a person, transferring a person, or it's with a particular object, okay? You need to know these types of questions. These are the layups. You don't want to be missing the layups, all right?
Nope.
Because if you're missing the layups, how the hell you'll get that level 3, okay? Next thing, nursing consideration / patient education relating to ambulating with the use of a cane. You need to know how a person should be ambulating, how they should be walking with the use of a cane or a crutch. Nice and simple, okay? The cane on the strong side, okay? Give me your hand. No, your other hand. No, this is my strong hand. If you know where that's from, you know. Oh! And so what's the next thing? Understanding legal responsibilities, okay? What is legal responsibilities, okay? Informed consent. There's informed consent pertaining to the provider, informed consent pertaining to the nurse, and informed consent pertaining to the actual patient, okay? You need to know how to answer these types of questions based off of the provided information and as well as advanced directives. Advanced directives, that's your living will and your durable power of attorney for healthcare, okay? You need to know these types of questions because these are the layups. Once again, don't miss these. Therapeutic communication, okay? All right, you missed this question, okay? You missed this question. I will be mad, right? Please do not miss any therapeutic communications. If the answer choice starts with Y, you need to say goodbye.
Perfect.
If the answer choice starts with Y, you need to say goodbye because that is not the correct answer. The moment you say Y, it comes off as judgmental. You don't want to be stupid by selecting that as an answer choice only to get it incorrect, okay? Don't select answer choices based off how you speak. You need to be selecting answer choices based off how you should be speaking as a nurse. Again, think like a nurse. That's tip number 1, right?
That's a great idea.
And then the last thing, nursing considerations for tracheostomy care, and as well as knowing suctioning and airway management for patients with a tracheostomy. Okay, all right. So let's go ahead and dive into a couple of things. Let me share with you a little bit. I haven't showed you the monster study guide. I told you if you stay towards the end of the video, I will show you not only the study guide, but how you can get your hands on this particular piece of information that's going to help you towards your ATI studying process, okay? All right, so stay with me, rock with me, lean with it, rock with me. Oh! So first things first right here, all right? We're showing off page 1. I'm going to show off a few pages. We're showing off page 1 of the ATI Fundamentals ATI notes that I personally, blood, sweat, and tears made. It's a 41-page monster, okay? All right, so when in doubt, raise the level of the bed. Super important, okay? This is one of the first things that you can do for a patient, right? I don't even really need to explain this, but if I will just really quickly. When you see a person is struggling to breathe, struggling to eat, one of the first things that you could do, obviously you want to give them that nice little ocular pat down. Shouts out to Mac from Always Sunny in Philadelphia, okay? Right? Give them that ocular pat down. And then the next thing you want to do is just raise the head of the bed. That's going to help with the airway, help with the breathing, help with the circulation, all right? It's going to help with the eating. The food is going to be able to pass down and properly digest and everything, okay? And you see images already. You see what I'm doing on the first page. Let's move on to the third page really quickly. And page number 3 right here, I am just showing you, once again, topics that's likely to be on the exam. So this is me just showing you types of transmission precautions, airborne, droplet, nursing consideration for droplet, nursing consideration for airborne, nursing consideration for contact precaution. These are things that you want to be able to pay attention to so you can properly get these answers correct throughout your studying process, throughout your journey to get this level 3, okay? All right, so let's move on to page 12 really quickly. So page 12 right here is just me displaying to you suctioning and airway management when it comes to a patient having with a tracheostomy, right? And the reason why this is super important because you may get tripped up on these questions when you're doing your practice questions, or you may see a question like this on your exam. Please do not miss these, okay? Because this is the stuff that you must know. I guarantee you that you will have a question or two on your actual exam pertaining to suctioning and airway management, okay? And you can even lump oxygen therapy type questions in with this particular thing. You must know this information. Let's move on to page 22 really quickly. So page 22 is basically me showing you once again ambulating while using the cane, right? Must know. You will have a question on it. I guarantee you will have a question on this, okay? And also ergonomic principles for you to utilize. If you want more information throughout just that entire chapter, look, let me just break the fourth wall really quickly. This stuff is just super important for you to know, even as a human being, just a normal human being. When you see people, you go to work and they got a bad back, bad health, bad everything, fat, obese, you name it, it's because they wasn't incorporating ergonomic principles that they should have been utilizing to optimize on their health, okay? You want to optimize on your health as well as get a level 3 on this exam. You're probably going to want to read this chapter. I'm going to be honest with you. Let's move on to page 24 really quickly, okay? Right, page 24 is just right here. I'm just scrolling out. So this is just me just showing you how I made a table for cranial nerves. Now, is there going to be a lot of cranial nerve questions on the exam? Probably not. But when there is one, you definitely don't want to miss this. This is stuff that you learned in anatomy and physiology. I don't know how long ago you took that class, okay? Perfect. But I guarantee you that if you follow along with this information, you definitely will not miss any cranial nerve questions on the exam. And then the last page to show y'all. So the last page to share with y'all is actually just showing you what the actual practice questions look like, okay? This is me just displaying to you the time that I spent on making these practice questions, tweaking them a little bit, changing the answer options to make them kind of tailor-made and fit for your studying process, okay? I didn't really ask you any questions on here that you probably wouldn't get on your actual exam. There are going to be things pertaining to things you may see similarly on your actual exam, okay? And that pretty much concludes the rest of the video. Let's move on to the next screen really quickly, okay?
But wait!
So that pretty much concludes the rest of the video. And just to give a brief recap over the 5 tips that we just covered. Tip number 1 was you have to master your approach at studying, your approach at looking at, your approach at viewing the subject of fundamentals, okay? That's you thinking like a nurse. That's you keeping in mind the things that incorporates the art of fundamentals, right? Critical thinking, therapeutic communication, clinical application, you name it, okay? Evidence-based practice, that's tip number 1. Tip number 2, hella practice questions, okay? 50 to 75 a day, right? Tip number 3 was reviewing and going over the rationale of each question and also each answer choice, okay? You want to pick up on some of these patterns, pick up on some of the information that is being dished out to you. Tip number 4 is utilizing the study guide in conjunction with any other information that's out there. I don't care if you're using Quizlet. I don't care if you're using the ATI book. I don't care what you're using. However, if you use my study guide in conjunction with everything that I'm saying, including this video, I guarantee you that you will get a level 3. And then finally, tip number 5 was topics that's likely to be on the exam, and I covered that in the video. So if you liked everything that you've seen, make sure you leave a like, comment, subscribe, do all that good stuff. Hit the bell to be notified. Until then, I look forward to talking to you guys on the next video. It's Jamal Hockey, channel dedicated to helping individuals unlock the will to conquer imagination. So without further ado, peace out.
Step 2, listen closely if you wanna get that test pass. 2 things you're gonna click on up in that test tab. Dynamic quizzes where you wanna put your head at. 60 question time, 7 days, that's some quick math. Few modes, I suggest to study as your eyes